Well, it's a little bit of a more chilly morning than what we're used to at this time of the year, but thank you very much for being here. I'm Gary Manns. I'm the Associate Vice President for Marketing and Communications. It's another good day for USA Health, and to help share that with us, we've got several people here who are going to talk about a new facility that we're going to have coming on board here in probably in March. First, we're going to have Owen Bailey, the Chief Executive Officer for USA Health, give some remarks. Then Dr. Jimmy Walker, who is one of the founding members of Mobile Diagnostic Center. And then Dr. Kimberly Donnellan, who will be providing services here in this facility. And with that, Owen?
Thank you, Gary. I do want to welcome you all to this ceremony, and those of you who were able to join us in person, and those of you who are joining us virtually, we thank you for being with us to celebrate this exciting event. I do want to thank our marketing team for setting up the virtual component of this and for all the great work that they do. You know, it does seem like we've been having a lot of groundbreakings and ribbon cuttings recently, which is exciting, but also very important for us as the only academic health system in this entire region of the Gulf Coast. So these are exciting days of growth for us, and as we focus on our mission of helping people lead longer, better lives through our focus on providing care, but also education and research. So we are excited to be here together with you today. And what a great location. It's just exciting for us to have this Midtown presence. There's so much good growth happening in Midtown, and we are excited. I mean, great food and shopping right over there. You've got amazing ice cream right behind us. No wonder so many people on our team want to work out of this facility. So we're excited about it. We have had a number of these, as I mentioned. Just last month, we had the ribbon cutting for the Fanny Meisler Trauma Center at University Hospital, one of the best facilities of its kind you're going to find anywhere. A fantastic new home for a fantastic team that we have. And we moved in just recently, and we are pretty much already filling up that great facility, which was much needed. Other projects, we have a freestanding emergency department coming up out of the ground out in West Mobile on Hillcrest Road, right adjacent to the University of South Alabama campus. That 24/7 ER will also have a full range of imaging and diagnostic services. Also at University Hospital, we are renovating in the 10th and the 11th floors to add over 60 beds, which are very, very much needed at that hospital. Over in Baldwin County, we have the MAP Family Campus. We're very excited about that project, where we'll be building a new professional office building for physicians, and that will also have a full range of diagnostic and imaging services as well. And we have applied to the state for a certificate of need for an ambulatory surgery center to be on that site, which we believe is needed as well. So we are excited about that project over in Fairhope, and looking forward to taking the academic mission even more strongly into Baldwin County. We also are finishing up plans for a new pediatric emergency center at Children's and Women's Hospital. This is also badly needed, and we've got an incredible team in there operating out of an old area of the hospital. And so we are excited about a brand new location for the thousands of children and their families who come every year to that great hospital. So that project will be submitting a certificate of need application very soon here with the state to add that new ER to Children's and Women's. We've also been developing partnerships in the community with more and more physicians, many of whom have trained at USA and are getting re-engaged with the USA Health System. That has made a tremendous impact. This facility here will help showcase some of that partnership. And I also want to mention that the key role that USA Health has played in the battle against COVID-19. We've had an incredible partnership with the city of Mobile. I just can't say enough about that partnership and what it has meant to this community, and how great the city has been for our team to deal with. We have an incredible team leading that effort. We've tested over 27,000 people as part of that process, and now we have vaccinated over 7,000 people, and those numbers obviously are going to go up, and we're excited about the vaccination process and playing a key role in that. So today, this building, to turn our attention here, is continuing to kind of blend the academic mission and focus we have with the community and creating more access points into our system as we grow. This project is going to have two specialty areas to begin with, and this will grow and probably change. Endocrinology and diabetes, and also ear, nose, and throat and plastic surgery. And it's a beautiful building, and we're very excited about it, but I always like to remind us, it's not so much the building, it's about the people in the building, it's about what's going to be going on, the care that's going to be provided by our great team, but also the education focus and research that comes with being an academic system. So I want to welcome several people who were able to join us here in person today. We've got Judge Mike Wyndham, who is also a member of the USA Board of Trustees. Judge, we are thankful that you are here. President Tony Waldrop, President of USA, we're certainly thankful for Dr. Waldrop and his leadership. We got several members of our USA Health team, Dr. John Marymont, who is Vice President for Medical Affairs and also Dean of the College of Medicine. We appreciate his leadership. Michelle Dudley is here. Michelle is Executive Director of Practice Management, played a key role in this facility and plays a key role in our ongoing partnership with physicians in the community and our faculty physicians. Excuse me. Danny Rickards here. Danny's our Chief Policy Officer, also played a key role in this facility, and it's also his birthday. Happy birthday, Danny. 29 again. There you go. Harry Brislin's here. Harry, thank you for your expertise in real estate and all you do for the university. We value our partnership with you as well. Thank you for your work on this facility. Have I got everybody? And Gary, who you've heard from, did you say me? Our marketing team. I also want to thank our partners on this project, Garrison McMillan with TELUS Partners, LLC. They are the developer for this project. Mark B. Hammond, the architect for this facility. And we also enjoyed working with John Vallis on this project as well. We thank them for their role. You know, one thing that makes this a little unique in this facility is that it's really a homecoming of sorts for the physicians of Mobile Diagnostics Center, which started here in Midtown in 1982. And so to share a little bit more of that story is Dr. Jimmy Walker, who was one of the original physicians in Mobile Diagnostics Center and one of the senior leaders there today. And I will add, Jimmy, we enjoy working with you so much. We value this partnership. Dr. Walker has an incredible knowledge of this community, of the medical community in the Mobile area, and besides being just an outstanding physician and partner with us, he's a good friend. So I'm going to turn it over to Dr. Jimmy Walker. We thank you again for being here today.
Thanks, Owen. First of all, it's cold, so I'll be brief. I want to put out a shout out and a thank you to Dr. Alan Whaley, Owen Bailey, Dean Marymont, and President Waldrop for making MDC an integral part of the University of South Alabama healthcare system. We joined USA over 3 years ago, and we've never looked back. We've never once regretted that decision of becoming part of USA. We have grown from 20 providers, we had internists and 3 rheumatologists in mid-levels, to well over 70 providers today. We're serving over 40,000 patients in the community. We've added family medicine, pain management, OBGYN, pediatrics, urology, dermatology, allergy and immunology, and now otolaryngology and plastic surgery. In the near future, we'll be adding a large heart group, cardiology group to our organization, as well as a large pediatric group. This clinic was just an idea 3 years ago. The groundbreaking, this was all red clay, and it was held right there. I remember it well. It's just an idea, now it's a reality. This clinic, in my opinion, is a model for the future. An academic coupled with research, merged with a patient-centered private practice model to offer evidence-based care and a center of excellence. The level of patient care experience that it is the best in the region. I said region. We will be able to offer an educational experience for residents and students, and hopefully in the near future fellows as well. Dr. Kimberly Donlin has joined us and brings with her the level of expertise to our healthcare system with a level of competence in otolaryngology and plastic surgery. I'm sure she's going to need associates in the future, and we'll need to expand this facility. But when you have the best, it's easy to recruit. Patients will come here. They will come here because of reputation. They will come here because they are referred, because of the expertise. Bob Israel, who helped found, he and I founded MDC, we're both dreamers and doers, but we can do both with USA. So thank you, Alan, Owen, John, and Tony, and Michelle. Thank you. And now, Dr. Conley.
Thank you, Dr. Walker. What a wonderful day it is for me today in so many ways. I am both a native of the Gulf Coast and a graduate of the University of South Alabama, and I'm so excited to provide an impact in this community. This opportunity is in large part due to the tremendous growth the USA Health has had over the past several years. As part of an academic health system, I am able to provide all our patients with the most technologically advanced equipment and treatments. My training is in both head and neck cancer surgery and cosmetic surgery. This training allows me to treat a tremendous number of people that suffer from skin cancer and provide them with the most advanced options for reconstructive surgery. We will also offer a broad range of cosmetic surgery that will include laser resurfacing, scar revision, facelifts, and eyelid surgery, just to name a few. In my opinion, cosmetic surgery is about helping patients feel confident and feel like their best selves. I look forward to when we open our doors here in Midtown. Thank you very much.
At this point, we'll go ahead and get everybody in place to have the ribbon cut, and then we'll have interviews with the media following after that. Bill's going to take a couple of photos here real quickly. And once he's up there, there we go. But those scissors are yours, and are even there for you.